Hey guys, just wanted to do a quick video update. Figured it might be a little bit easier. We're still waiting to see Arielle. Um, so the surgeon did pretty much what we were expecting him to do. He went in, he moved the stomach down and wrapped it around her esophagus, and that was to basically tighten her sphincter. That way, now when she swallows food, the acid should not come back up. So that should stop her from throwing up and hopefully help her feed better. He also put in the G tube, a gastric tube, which is basically how she will be fed. So she had a nasal tube going down her nose into her stomach. That will be removed. She will be feeding off of that for the next few days until she kind of heals a little bit, and then they will take that out and start to feed her through the G tube. Um, he also found, I think we had told you guys that there was a possibility that she had inguinal hernias, which is down in her intestines. And in fact, she did have them. She had them on both sides. The surgeon had said if there's one on one side, there's probably going to be one on the other side. And sure enough, there was. So he repaired those as well, and those are fine. There's the recurrence rate with each of these. There's a like 1% recurrence rate of the inguinal hernia, meaning like she might need to have another one. But as you can see, it's very small. And there's about a 5% recurrence rate with the hiatal hernia with the Nissen, that she might need a second Nissen down the road. Sometimes it comes unraveled. But again, he was not really expecting that with the way he did things. He said the surgery went very well. It was a little tough to wrap her stomach around the esophagus, obviously, because it's a little small, but he was able to get it done, no issues, very minimal blood loss, so she shouldn't need any additional blood. If she does, it's just sort of in the NICU thing, but it wouldn't be a result of the surgery. She's still intubated, meaning she's got a breathing tube down inside of her. We're told. We're waiting to go see her. We should be able to go see her in a few minutes. Um, let's see, otherwise she may be a little bit puffy. She's going to have 5 small incisions. The surgery was done laparoscopically, which means that there's small little incisions, and he inserts a camera into those incisions so that he can do the surgery that way instead of having to cut her open. So he was saying he might have to cut her open, but he didn't. He did it laparoscopically. They're small incisions, and they should heal on their own. She may have like a little tiny scar, but nothing major on her. Um, the surgeon will stop by and check on her tomorrow morning. After that, he'll be gone for a couple of weeks, but we'll be able to follow up with him afterwards. But otherwise, it's just kind of waiting and letting her heal right now. She's going to be on pain meds right now. She'll be on Tylenol and another pain. What's it called? What's the fentanyl?
Fentanyl.
She'll be on Tylenol and fentanyl. I think the fentanyl is just overnight, and then she'll continue on the Tylenol for pain management. Otherwise, they're going to let her sleep. They won't be feeding her until tomorrow. They're wanting to give her, I think, 24 hours post-op. Um, and otherwise, the healing, so in 3 weeks, she would be at about 75% recovered. And in 6 weeks, he says she'll be as close to 100% as she'll ever be in terms of recovery. So that's where she's at. I think that's about it. Hopefully, we answered all of your